What are the deadliest diseases and what is it like to die from them? This week, I'm including all cancers. The reason I'm doing this is because usually there are two types of patients that come onto hospice. There are the chronically ill with some kind of terminal chronic disease like COPD, CHF, Alzheimer's dementia. Then there's the patients with cancer, and this is any type of cancer. There, of course, are a few outliners here and there with like rare diseases, but generally speaking, there's two types. This type over here with any type of cancer usually will have the same progression in hospice, and it's a steady decline. It's not a stairway decline like the COPD patients or the CHF patients. So what is it like to die from cancer? Again, I'm being general here, but any one of you guys who wrote into me and said, what is it like to die from prostate cancer? What is it like to die from multiple myeloma? I'm trying to group all of these together to give you guys a general idea. Some cancers have more symptoms than others. If it's some kind of tumor on the brain, they're going to have symptoms like confusion, sometimes seizures, sometimes headaches or pain, definitely cognitive issues. So forgetfulness or maybe inability to speak or difficulty swallowing because the brain does a lot of functioning for our body. Anything that has to do with the liver. So if the cancer doesn't start in the liver, but it was somewhere else and moved to the liver, a lot of times many symptoms you see at the end of life will be liver related. So cognitive issues, confusion, a lot of sleepiness, some pain. They'll have that ascites, which is fluid in the abdomen that you have to either drain in the home or go out and get it drained. This can cause shortness of breath and pain. So it really depends on what kind of cancer you have. But generally speaking, anyone coming onto hospice with cancer will either have very little symptoms because for whatever reason this cancer is not giving them much symptoms, or they'll have things like pain, shortness of breath, confusion, nausea, and vomiting. Those are the main symptoms I would see. And guess what? Hospice is really good at managing those symptoms. One thing I like to say about cancers in general, about what to expect if you're coming on hospice with any type of cancer, is this. If you weren't experiencing tons of symptoms prior to coming onto hospice, then you likely will not experience symptoms when you're on hospice. So most people who come onto hospice, if they've been like, you know what? Mostly I just sleep a lot and don't really eat. That's probably how it's going to go on hospice as well. You're not going to come onto hospice, get towards the end of life, and then suddenly start having tons of pain or tons of shortness of breath. But if you came onto hospice with a lot of symptoms already being managed, you already were having seizures, you already were having a lot of nausea and vomiting, you were already having a lot of pain, that will likely continue into hospice. Now, I will say hospice is really good at managing symptoms. So a lot of times people will come onto hospice with all of those symptoms and then they actually start feeling better because we actually manage them very well. So in general, your disease is going to carry on as it had been. You won't just suddenly start having random new symptoms just because you came on hospice. And like I said before, generally speaking, anyone coming onto hospice with any cancer diagnosis, you're likely going to have a steady decline, like a ski slope versus a stairway slope of these like events happening, you go down, events happening, you go down. It's just going to be a steady decline. So you're going to come on, you'll be maybe eating 2 meals a day and you're able to walk around your house, maybe go out for a walk around the block. Then let's say a month later, you're eating 2 meals a day, but those 2 meals are only little bits of food each time. And maybe now you're not really walking outside anymore. So you're seeing that slow decline. You're slowly declining, eating less and less food, sleeping more, walking around less. You're going to see this steady decline. That's all normal and to be expected. And I see that in almost everyone that comes onto hospice with a cancer diagnosis. Another thing I want to mention is everyone coming onto hospice with cancer will eventually need 24-hour care, meaning someone in the home fully caring for them. And that really goes for anyone on hospice. I think a lot of people forget that at the end of life, someone's going to be fully bedbound, incontinent, so they're going to need changed because they'll be urinating and defecating and someone's going to have to change them. They'll be needing dressed, they'll be needing to get bathed. All of that, if they're going to be in their home, is going to have to be done by the family. And I don't say this to scare you, I say it to prepare you. I think so many people see their loved one who's so used to being independent and coming onto hospice, walking around, doing their own thing, but they will eventually, if they're going to die naturally on hospice, will be down here fully bedbound and need what we call max assist for ADLs, meaning changing, cleaning, feeding if they're still eating, but usually they aren't. So they will eventually get to that point, and that's normal. And it's just good to prepare and know, hey, who's going to be doing the care? Is it the family? Are you going to have paid caregivers? Because unfortunately, hospice does not take care of that. Generally, like I said, there are two types of patients that come onto hospice. Of course, like I said, we're talking about the patients with cancer in this video, and it is going to differ slightly depending on what type of cancer you have. But I think it's important to know that most people coming on to hospice with cancer will have the same experience, right? They're going to have some symptoms that will be managed by hospice, and just know that they're going to decline in a steady slope with functional ability, mental ability, and eating and drinking. They'll slowly decline. That is common and to be expected. And I think that's the main thing we need to focus on. And at the end of the day, when you're asking yourself, what can we do? What should I be doing? You just say, are they clean? Are they safe? And are they comfortable? And if they are, you can relax and just be with them. Thank you for watching, and don't forget to follow for more death and dying information.